Good afternoon, and thank you for joining us for our weekly update. I apologize that unfortunately today our interpreters were not available due to a scheduling mix-up. But I am pleased as always to be joined by Dr. Lawrence Lowe, Peel's Chief Medical Officer of Health, Darren Rizzi, our Fire Chief and Director of Emergency Management, Sam Rogers, our Director of Enforcement, and this week, a very special guest, David Wojcik, who is the President and the CEO of the Mississauga Board of Trade. David has joined us today to talk a little bit about new programs MBOT is offering businesses to help keep employees and their customers safe as we see more and more reopenings. Before I give my COVID update, I want to say that I'm deeply saddened today by the news that 182 sets of human remains were discovered in unmarked graves near the site of a former residential school in Cranbrook, British Columbia. The city of Mississauga grieves with the Lower Kootenay Band and for all the children in unmarked graves who never had a full life and have experienced tremendous pain and suffering. Mississauga stands in solidarity with all the Indigenous communities across Canada. Mississauga, as of today, we're officially in step 2 of the province's roadmap to reopening. This is a significant step forward for everyone, but especially for some of our small business owners. For the first time since November 23rd, that's more than 7 months, our personal care provider services have once again reopened their doors. These businesses have been among the hardest hit by COVID and the extended lockdowns. So I'm absolutely thrilled that they are finally back in business. Right now, all we need to do is go out and support them. So if you're able, please book a haircut, a mani-pedi, barber trim, spa service, and do it as soon as possible. And I'm really hoping for all our sakes that Mayor John Tory can book his haircut as soon as possible. Let's just say that Mayor Tory's hair has gotten a little bit unruly. Along with personal care providers opening at 25% capacity, there are some other significant changes starting today. Among them, outdoor social gatherings and organized public events are permitted for up to 25 people. Indoor social gatherings and organized public events are permitted for up to 5 people. Outdoor dining increases to 6 people per table. Essential and other select retail are now permitted to operate at 50% capacity. Outdoor sports leagues can resume in accordance with the rules and regulations outlined by their provincial sports organizations. Non-essential retail capacity increases to 25%. Stores and shopping malls are now permitted to open with restrictions. Overnight camping is open just as the kids are getting out of school. Our public libraries are permitted to open at 25% capacity. Outdoor cinemas, performing arts, live music events, and attractions can all open at 25% capacity. I'm so thankful that we've gotten to this point where we are once again enjoying the activities that are so essential to our physical and mental health and well-being. And we're here and actually opening earlier than expected because the case counts continue to steadily decline. Both Peel Region and Mississauga are now averaging 12 cases per 100,000, and that's down from 21 cases per 100,000 last week. And that's 20 times fewer cases than we were averaging just 2 months ago. Our hospitals continue to improve each and every day, with 10 COVID hospitalizations at Trillium Health Partners, 1 patient in the ICU, and 44 suspected cases. But some people are still hospitalized and recovering from the long-term effects of COVID. The situation is similar at Brampton's William Osler Hospital, with 8 COVID hospitalizations, 3 patients in the ICU, and another 29 suspected cases. Trillium Health Partners is back to 79% of pre-COVID surgical capacity for elective surgeries, and the hospital expects to be at 100% capacity by the fall. I know that a lot of people are feeling a sense of optimism that they haven't felt in a very long time, and I'm certainly feeling it too. For me, the biggest reason why is the incredible vaccine uptake that we've seen in the region of Peel. About 75% of Peel residents 12 plus have received at least one dose of the vaccine, and about 30% have received 2 doses. Thank you everyone who's gone out to get their shots. It is really the single biggest reason why we're moving ahead in the province's reopening framework. And I want to thank publicly, once again, Dr. Lawrence Lowe, our Medical Officer of Health, our hospital partners, the doctors, the nurses, the paramedics, the firefighters, and the countless volunteers for taking part in this historic effort. We simply wouldn't be here if it wasn't for everyone's hard work. And to those who haven't yet received their first or second dose, please book as soon as possible. I continue to receive emails and social media messages from people who can't find an appointment, but I encourage you to please keep trying. Just yesterday, Peel Public Health opened up to close to 300,000 new appointments across our mass vaccinations clinics for booking up until July 25th. This is great news, and it will help get more first and second doses into arms of all our residents. Everyone 18 plus who received either Pfizer or Moderna, or those 12 to 17 who received their Pfizer, are now eligible for their second dose if it's been 28 days since your first dose. If you received AstraZeneca as your first dose 8 weeks ago or longer, you're also eligible for your second dose of Pfizer or Moderna. So I encourage you to please book ASAP. You can book through the provincial online booking system or by calling 1-833-943-3900. I know some people are still hesitant about getting a different second dose from what they received the first go-around, but it's becoming increasingly clear every day that getting your second dose with either one of the mRNA vaccines is completely safe. Last week at my press conference, we were joined by Dr. Dale Kalina from Joseph Brant Hospital, who spoke about the efficacy of getting either Pfizer or Moderna as a second dose. And he also provided a bit of important context. It's actually standard practice, for example, to give elderly patients different brands of pneumococcal vaccine to increase their immunity. So mixing vaccine is not uncharted territory at all. And health experts across the country, including Dr. Lowe, says it's completely safe to get a second dose of either Pfizer or Moderna. So please, don't hesitate, book now. I'm also thrilled that Peel Public Health is running a youth vaccine blitz this weekend called Crushing COVID for residents 12 to 17 years of age. They're offering 1,000 doses of Pfizer vaccine at the Paramount Fine Food Centre from 3 p.m. to 9 p.m. on Saturday, July 3rd. There will be limited walk-ins, so the best way to book is by visiting Peel Public Health's website at peelregion.ca/COVID-19 vaccine. Along with the vaccine, there will also be some prizes and some giveaways for some lucky visitors. I really can't say enough about how thankful I am to our young people for going out to get their jab. More than 63% of 12 to 17-year-olds have gotten their first dose. And as part of Peel's effort to win the battle against COVID and take back the summer, we're launching Second Dose Coast to Coast, a Canada-wide vaccine challenge. From July 5th to the 11th, we'll be going head-to-head with the City of Calgary to see who can get more doses into arms. We have lots of exciting things planned in Peel, so stay tuned for the details. Let's do this, Peel. But as encouraged as I am about the progress we've made on the vaccine front, and as excited as I am about more of our businesses reopening, we still have to remain extremely cautious. I support the advice of the province's new Chief Medical Officer of Health, Dr. Kieran Moore, that we should only move into step 3 of reopenings after 3 weeks. so that we can get more shots into arms, to give us time for the vaccines to kick in, and also to assess the trends. I support this approach because we've seen other countries, like the UK and Israel, forced once again to impose tougher restrictions after initially loosening them. The Delta variant is very real and a significant threat to the gains that we have made. And we need to take our time and reopen slowly and cautiously to ensure that we don't see a sudden spike in cases. Our businesses can't afford to move backwards, and I know residents don't want to either. So I encourage the Government of Ontario to continue to move forward cautiously, and I encourage everyone to continue following the advice of public health. Before I invite up Dr. Lowe, I just want to say a few words about Canada Day. This year's Canada Day is going to be a little different from years past. First of all, we aren't celebrating in the same way we usually would because of COVID-19 restrictions. But I also want to recognize the incredible sacrifices you have all made over the last year to keep our communities safe. I know for so many people, it has been a very challenging time. And what's truly inspired me over the last year is seeing the true spirit of Mississauga emerge time and time again. We have seen so many of our residents, our businesses, and organizations come together to support those most in need, as well as our hospital partners, through countless food drives, PPE donations, and more. We have seen our frontline healthcare workers put their lives at risk, day in and day out, to keep our community safe. And we have seen our essential workers keep our economy running by going into work day in and day out to making the products that we all needed to survive. As a city, we have so much to be hopeful for. Hopeful that the next year and the years to come will be brighter and better. But this year's Canada Day is different for another very important reason. Over the past few weeks, Canadians have been reminded of parts of our history that cannot be forgotten. The City of Mississauga is committed to understanding and speaking the truth about our history, to further our collective understanding of the past, and to be part of the process to help create a better future. The heartbreaking discoveries of more than 1,000 unmarked graves and forgotten burial sites at former residential schools across Canada has deeply affected us all. Our country cannot continue along this same path any longer, not when the truth is staring us in the face. These were children who were forcibly taken from their families, and in many cases, never again seen by their loved ones. Before we can reconcile with Indigenous communities, we must first understand the truth of what happened, and then to reckon with it. This is why we will be marking Canada Day differently here at the City of Mississauga. We are not canceling Canada Day. Instead, we're giving residents of our city the time they need to reflect on the injustices of our past and imagine a Canada that we want for our children and for our grandchildren. We're giving residents the time to begin to heal. I'm proud to be Canadian. I know most of you are too. But to continue to be proud of our great country, we need to do better. We need to create a future that is welcoming and a safe place for everyone. We each have a responsibility to learn and to grow to help make things better. And that's why, along with unanimous support from my council, we will be changing our Canada Day ceremony. We will be hosting a virtual ceremony that acknowledges the pain that exists right now and the work that needs to be done to reach true reconciliation with Indigenous communities. The ceremony includes a powerful message from Gima Stacey Laforme, Chief of the Mississaugas of the Credit Nation. And instead of lighting our clock tower in its usual red and white to mark Canada Day, we will be lighting it orange as a symbol of support to Indigenous communities and members right across the country. We will also be displaying messages of support on our digital signs at Mississauga's Celebration Square. Our council's motion to change our Canada Day ceremony also called on the Government of Canada to terminate its appeal of the 2019 Human Rights Tribunal ruling that orders the federal government to pay compensation to Indigenous children and their families who were separated through a chronically underfunded child welfare system. I truly hope that tomorrow, all of our residents reflect on the past and envision a brighter future for everyone in Canada. And now, I'd like to invite Dr. Lowe to the podium to provide his update. Thank you.
Thank you, Madam Mayor, and good afternoon. Mississauga's weekly incidence rate for COVID-19 sits at 12.4 per 100,000 new cases per population, with a test positivity of 1.8%. With our entry into Step 2 of the province's reopening framework today, I want to thank our residents and our businesses for their sacrifices and actions that got us to this point. Our situation in Peel was unique amongst communities in Ontario, and our situation in Ontario unique among Canadian provinces. We are more populous, more densely urbanized, more connected globally and to the United States, and many of our residents come from diverse backgrounds and work in jobs that can't be done from home. We averted the worst case scenarios seen elsewhere through your sacrifices and your work. Thank you. Not only have we collectively saved lives, but our sacrifices have also given aid to our hospital and healthcare partners and protected many more of the vulnerable in our community that might otherwise have met with misfortune. We can breathe a little easier because we are starting to see the exit from the acute phase of the pandemic taking shape. But just like playing the full game until the final buzzer, we cannot let our guard down now. Elsewhere in the world, we've seen how the Delta variant can quickly exploit vulnerabilities where contact interactions outpace the growth in vaccination coverage. On that front, our vaccination coverage is a community asset. Of our eligible population 12 plus, over 75% of those individuals have received their first dose, and we are approaching 30% second dose coverage in our 12 plus resident population. We are adding a remarkable 10% second dose coverage on our 12 plus population every week. And that is thanks to everyone's trust in science and commitment to look out for each other. The vaccines are clearly safe and effective, and from the height of a significant third wave peak, we are now seeing our lowest transmission levels since last September. Let's keep the momentum going across Mississauga and all of Peel. We need to combine our confidence in vaccinations with continued caution. We need to go slow to go fast. If we force the issue, we will only drive ourselves backwards as other jurisdictions have. And we fought too hard for too long to make that happen. So as we enter into Step 2 today, I encourage you, by all means expand your interactions, but do so gradually. Small groups, please. And as federal guidance suggests, for fully vaccinated individuals, that is, people who are 2 weeks out from their second dose, you can return to some semblance of normal interactions, particularly outdoors. Otherwise, it's important and essential to continue masking and distancing and favoring the outdoors if the people that you are meeting with are not fully vaccinated. That also is a reminder for all of us to get vaccinated with 2 doses as quickly as possible. Yesterday, Peel Public Health added nearly 300,000 appointments across our system over the next 3 weeks. We're constantly adding capacity to make it easier than ever for you to get your shot. Please get your first dose if you haven't already. It's clear that those who are falling victim to the Delta variant are generally those who are unvaccinated and also those who are partially vaccinated. The latter is why you should also get your second dose without delay. If it has been 28 days since your first dose, I urge you to access a second dose as soon as possible. All residents in the region of Peel aged 12 plus are eligible for accelerated second doses now. Do not wait for your previously booked appointment. Visit peelregion.ca/COVID-19 vaccine today to book an earlier second dose. This coincides with the launch of our Second Dose from Coast to Coast campaign next week from July 5th to 11th. And you can be part of the fun and festivities that are planned across our clinics as we work together to take back summer. There will be live music, DJs, giveaways, and a 40-hour overnight marathon on Friday night at the Save Max Centre in Brampton. Our goal is to challenge our colleagues out in Calgary and across the country to get to 2-dose coverage as quickly as possible. So I encourage you to do your part, get to 2, and share your vaccine story with the hashtag 2, as in the number 2, dose challenge. Also, our youth, 12 to 17 and their families, can get their second dose and even walk in for their first dose at our Crush COVID clinic that is being held this Saturday from 3 to 9 p.m. at the Paramount Fine Food Centre. But remember, I encourage you not to delay. Appointments are available. There's going to be some fun and games at our clinics next week, and that's how you can get your first dose, if you haven't yet, to protect yourself against mortality and hospitalization. And if it's been 28 days since your first dose, rebook a second dose as soon as possible. Thank you, and I'll pass it back to Madam Mayor.
Thank you, Dr. Lowe. And now I would like to invite Dave Wychuk, President and CEO of the Mississauga Board of Trade, to talk to us a little bit about some really great initiatives that MBOT is working on. David?
Well, thank you, Madam Mayor. And I'd just like to let everybody know that I have had my second dose. I got it on Monday. My first dose was Pfizer, my second one, Moderna. Other than a sore arm and a very, very good night's sleep on Monday night, I've had zero effects from the vaccine. So I would encourage you, please, please, go and get the first dose and go and get the second dose as soon as you possibly can. As the voice of business in Mississauga, the Mississauga Board of Trade has been working on various projects through our MERGE initiative. The MERGE is the Mississauga Economic Recovery Group. This is a group of 50 CEOs across 6 sectors dedicated to uniting business for a thriving Mississauga. One of the many initiatives MERGE embarked on is FAST. It stands for the Fast Antigen Screening Toolkit. This toolkit contains a how-to playbook on how to set up a site for screening your employees. While the latest reports indicate we are closing in on 80% of Canadians receiving their first dose of the vaccine and more than 20% are fully vaccinated, variants remain a concern. And in my conversations with our Chief Medical Officer, Dr. Lawrence Lowe, we need to keep screening. This pandemic, or this COVID-19, is not going away anytime soon. So even when we're fully vaccinated, the variants will be around. We still need to test our employees. This is why we must continue to screen those asymptomatic employees for the COVID virus until our healthcare professionals are fully confident that we can move forward and when we're on the other side of the pandemic. In addition to FAST, the Mississauga Board of Trade partnered with the Ontario Chamber of Commerce, MedCat, and Health Canada to provide free antigen screening kits to Mississauga businesses under the Provincial Antigen Screening Program. Since starting the program on June 26th, we've distributed over 30,000 kits to Mississauga businesses. These kits are available through the Mississauga Board of Trade for businesses with up to 150 employees working on site. Businesses with more than 150 employees can apply directly to the provincial government to receive free kits. These kits are being distributed from space generously donated by Morgard Properties in the city centre. To get a free download of the toolkit, the Fast Antigen Screening Toolkit, and register for free antigen screening kits, visit mbot.com and look for the big blue button that says Free Rapid Test Kits. Finally, there has been much speculation who will replace me as President and CEO of the Mississauga Board of Trade when I retire at the end of August. I'm pleased to announce that the chair of the Mississauga Board of Trade, Ken Tenser, has directed me to announce that Trevor McPherson will be the new MBOT president and CEO effective August 9th. Trevor is currently the Vice President of Member Services at the Ontario Chamber of Commerce and is a consummate chamber professional. I'll be working with Trevor until the end of August, assisting him with the transition plan. And with that, I'll turn it back to Madam Mayor.
Thank you, David. And first, let me say my warmest congratulations to Trevor McPherson. We look forward to working with you along with my council members. So now, along with Dr. Lowe, Chief Rizzi, Sam Rogers, and David Wojcik, we are pleased to take any questions from the media. Daniel?
Your first question comes from Khaled Salama at My Second Home TV. Go ahead, Khaled.
Oh, thank you so much. Canada Day comes early. How's everybody? Thank you so much. Mayor, yesterday you made a joint announcement about the South Common Community Center, and that's a great addition to Mississauga. If you can tell us, please, when this should be over and when it will be commissioned again.
Yes, so we announced that the contribution that the provincial government is making along with the money set aside in our capital budget will equal about $61 million going towards the South Common Community Centre revitalization and rebuilding. So we're in the design and engineering phase of the project, and so stay tuned. We're very, very excited about this project and very grateful to the provincial government for the funding. Thank you.
Very well, thank you so much. And my next question might be to you and Dr. Lowe as well.
Certainly.
About the vaccine passport.
The vaccine which, Khaled?
Passport.
Passport. Oh, so to best of my knowledge, I'm unaware of a vaccine passport. I know that it is being discussed in some circles, particularly among federal government members, but to date there is no news about a vaccine passport. And Dr. Lowe agrees. He's saying that he concurs.
Thank you.
Thank you. Thank you, Khaled, and happy Canada Day to you.
Your next question comes from Steve Cornwell at the Mississauga News. Go ahead, Steve.
Welcome, Steve.
Just on the consideration of renaming Dundas and possibly other streets and landmarks in Mississauga, there's also discussion today at Council about some of the challenging aspects of making a change like this, but I'm curious about what you would personally need to see in the coming staff report or hear from residents that would compel you to decide in favor of renaming Dundas Street.
So, Steve, this is an enormous undertaking, and, you know, it won't be squarely or solely the street of Dundas that could potentially be recommended for change. I just want to say that we haven't made any decisions. I know there have been calls and emails to my office that are suggesting that I've already decided we're renaming, but it is a very large undertaking and we need the support of all of council members. And as you heard today, there are council members who don't agree with the renaming. But because it's such a large undertaking and could be an enormous cost to the city, we know that just in street signs alone and markings, the City of Toronto plan to spend about $6 million on the name changes, and of course it means renaming Young Dundas Square, etc. There are a number of businesses that would be impacted. I'm thinking of Dundas Street Grill, etc. So the impact is enormous. Even the deed to your property would have to be changed. So we're going to take our time, get this right, and we're going to look at other streets that could potentially be affected by the call for a name changing as well. So I want to get this right, and that's why we're not giving them a deadline. We said, please come back to us in the fall with a work plan. I understand how many of the racialized, marginalized communities feel that this is the systemic racism built into the system, that it is insensitive of us to name streets or other places, squares or monument statues in the name of individuals who have a historical past that is unacceptable by today's standards. So this is something we'll look at very closely and come to a decision. But of course, we have to weigh it with not only the moral and the ethical thing to do with the cost to the city that it could result.
Thank you, Mayor Crombie. My follow-up's actually for Dr. Lowe.
Perfect. I'll call him to the podium. Thank you.
Thanks. Dr. Lowe, I wanted to ask you about the Public Health Agency of Canada's recent recommendations on masking for those who are fully vaccinated. According to their recommendations, masks aren't necessary for those who are fully vaccinated in indoor settings with a small group. Instead, masks should be considered indoors if you're fully vaccinated and in a large crowd. I know you recently recommended that indoor mask bylaws for public spaces in Peel be extended until the end of September, but I'm curious about what kind of indicators or benchmarks you're looking for in order to ease indoor mask rules across Peel. I mean, for example, do you have a full vaccination threshold in mind or something like that before you would consider kind of recommending easing indoor mask rules?
Yeah, thanks very much, Steve. So there's two answers to your question. First of all, in respect of interpreting the FAC guidance. So the way the FAC guidance is you have the setting on your left-hand side, and then you have your individual risk at the top in respect of vaccination. So what it is saying is that if you are indoors in a small group and you are fully vaccinated and everyone in that group is fully vaccinated, then you can consider dispensing with mask use. So it's important to qualify that. It is both looking at the individual as to your vaccine status, and it's also looking at the specific setting. So I believe it says indoors with a group of individuals who are fully vaccinated. So in that case, if you are not fully vaccinated or partially vaccinated, then I think it says consider masking, or you can do it if everyone's okay with that kind of thing. And it says if you're fully vaccinated, then it says you can consider leaving your mask behind. So it's a two-part thing, and that's very important for people to know. Assess the situation. Is everyone else vaccinated? And then assess your own individual situation. Are you vaccinated? Of course, it's a lot easier if everyone can just be like Dave and myself and everyone else who's gone and got their 2 vaccines, because ultimately then it becomes a much more simpler equation. But in respect of the indoor masking bylaws, those pertain to public spaces. And as you know, those are very different from small groups where you can be assured of the vaccine status, for example, if you're getting together with extended family or close friends who you're willing and able to share that information with. We know that even though we are at 75% first dose coverage for 12 plus, there are still 25% of people in our community who have not yet received a vaccine. And they are therefore at risk of more severe diseases, particularly with the Delta variant in question. And they are also more at risk of being infected and potentially transmitting onwards. And so it's for that reason that the indoor mask bylaw, at least in public spaces, and if you read all the way down to the FAC guidance at the very last scenario where they say if you're in crowded spaces or areas where you don't know people's vaccine status, they still recommend as well that you consider wearing a mask even if you are fully vaccinated, and the bylaw reflects that. Thanks for the question, Steve.
Next question, please.
Your next question comes from Isaac Callan at the Pointer. Go ahead, Isaac.
Welcome, Isaac.
Isaac, okay.
There he is.
Perfect. With council wrapping up for the summer, I was looking down your list of advocacy points with other levels of government, and it's quite extensive. It includes things like the PILTs, new revenue tools, the arena, the BRT on Dundas, the downtown loop for the LRT, funding for 10 hydrogen buses, 20 million in green retrofits, an MZO for a film district. And just with that summer period coming up and the potential of elections as well on the horizon, can you tell me what your sort of number 1 and number 2 advocacy points are, priorities for the summer?
Yes, indeed. It's going to be a very busy summer, Isaac. You've identified that well. I will share with you that I did have a meeting with the minister and his key officials and ours at the city on PILTs. And if I had to choose one of the list of our priorities, I would say it would be making the change to remove the 5% cap on the PILTs. That is critical, vital for the city of Mississauga that change be made. It represents a huge structural deficit in our finances. And so I think that would be the number 1. All the others will be discussed. As you know, we have AMO in August, and I will have a round of meetings with each of the ministers, and I will highlight each one of those. And in addition, there are letters to be written and meetings to be had on a one-on-one basis as well. So an extensive list and a busy summer.
Follow-up, Isaac?
Yeah, on the PILT, obviously, we know the 5% cap could be helpful in the next 3 or 4, maybe 5 years' time, depending how air travel responds and how it rebounds. But in the immediate term, there's a massive deficit, roughly $22 million for the city of Mississauga that's not addressed yet. Do you have a solution in mind for that?
So let me first say that the PILTs impact us for the next 35 years. And not only the 2-year lag, it's the 5% increase each and every year, and it's causing a $22 to $23 million deficit on its own each and every year, which is the equivalent of a 4% tax increase. So this is the most fundamental and vital change that is needed, Isaac. And your question was, I forgot. oh, yes, do I have a plan to? Yes, I do. Yes, of course. So we'll put many of the measures in place that we did last year. Of course, we are running transit again. I assume we'll be having some reopenings of our community centers. It's transit that makes the biggest impact, as you know, about $7 million a month, and there have been routes that have been canceled, and so that did accrue some savings to us as a result. So we will be looking back at the measures we had in place and revisiting those, certainly in the non-discretionary spending. Certainly we have laid off staff. Some of those have been recalled as our community centers are reopening. And, we will be discussing with government safe restart programming and the opportunity to receive additional compensation for the operational deficits as a result of COVID-19, and in particular as a result of our public transit. I think it is the cities with the largest transit networks that will suffer the most.
Your final question comes from Steve Picard at Mississauga. Go ahead, Steve.
Hi, this is for the mayor.
Yes, I'm right here, Steve. Welcome.
Thank you. The question is about, again, the street names in Dundas in particular. Considering that you've mentioned in the past and other councillors have said that there hasn't been a huge outcry for the name change, you mentioned today that the Black community consultations wasn't an issue there. That being the case, why are you proceeding with this process?
So with the Black community consultations, they did ask for street namings and monuments, etc., to celebrate the Black heroes of our community. So they didn't ask specifically to eliminate the current namings, but, we will undergo the same sort of consultation that was done in Toronto. I think the answer is consistency. I mean, this is a street that starts in Toronto and runs right through Mississauga, right through Oakville and Burlington, right to the town of Dundas. So it's something we need to look at. Whether or not we'll proceed with it is another question, but it's certainly vital and very important to take a look at on how to proceed. And it's not only Dundas, but as you know today, many other street names were mentioned. Winston Churchill Boulevard, some of the other names in southern Mississauga as well. So it's an overall exercise to determine if it's the direction that we want to proceed in or not, because I do agree it would be an epic move that would have enormous cost to the city.
Follow-up?
Yes, and in terms of the Canada Day, you mentioned that it is going to take on a somber tone this year as opposed to a more celebratory. Do you think that's the message Mississauga residents want to hear coming out of the pandemic?
Well, unfortunately, given the recent circumstances and the recent findings of the unmarked graves, and, another today, how many more children were found in another grave? It's 182 today in Cranbrook, 751 in Cowessess Nation in Saskatchewan, and then 251 in Kamloops, and we expect that anywhere there is a residential school, we may see evidence of unmarked graves. I mean, this is critically important to reconciliation, that we come to terms with what has been a very dark chapter in Canada's history, and I think people do need time to reflect. And while you're correct, people are a little more in the mood to, with the reopenings and the great case counts, to celebrate. We're asking for one more day to take that time to reflect on our history. It is Canada Day, so we are a great nation, and we really need to do better going forward. And the only way we're going to do better is that we address the mistakes of the past, confront them, and act on them.
Mayor, that concludes the questions for today.
Thank you very much for joining us today.